Alright everyone, so let's start with where we left off. We were talking about throat conditions earlier, conditions such as pharyngitis, tonsillitis, and laryngitis. Now we're moving on to oral conditions. First condition that we have here is known as oral candidiasis. This is a fungal infection affecting the oral cavity. So what you're gonna see is this white, cheesy, curd-like patch over the tongue or maybe the oral cavity area, which you can easily remove by scraping. Maybe you can use tongue depressor or toothbrush or your finger, and then kind of scratch this white stuff. It's gonna come right off. Now, this condition itself is not a very scary condition. As long as you start to take some antifungal medications, everything should go away within about 2 weeks or so for the most part. But the little scary part is you're going to have to think about why this patient possibly developed this condition. Because this condition is seen in immunosuppressed patients. So patients whose immune system has been kind of a little bit lower for some reason. If you're looking at the infant patient, not a big deal. Their immune system is just not as high as adults just yet. So that is okay, not too concerning. If you're looking at the adult patients though, that's a little bit of a bigger concern. If they recently experienced some kind of infection and been taking some antibiotics or taking some kind of steroid treatment, that's understandable. But if you cannot identify a reason, any apparent reason, the next possibility you're going to have to think about is HIV. Maybe this individual have infected with HIV and then maybe haven't even realized that yet. So, other than getting the antifungal medications, when you're making a referral, another thing that needs to be considered is the possible tests for HIV. Next condition is the oral cancers. Not the most common type of cancers in the United States, but it can certainly affect certain population, 3% of men and 2% in women. There are actually certain risk factors that we're actually aware of. We know that this is going to increase the risk for oral cancer. The big one here is that any type of tobacco use, whether that's smoking or smoke less, any type of tobacco use is known to increase the risk for oral cancer. Not a great idea. Also, excessive alcohol use, poor oral hygiene, age is another factor, older than 40 years old, having a family history, as well as being male. You're going to find this as kind of a red or a white lesion in oral cavity first, and it start to grow, start to get worse. You might also see some tongue swelling, as well as dysphagia. We did talk about this today. This means difficulty or painful. Aphasia means speaking. So dysphagia means difficulty speaking or painful speaking, as well as abnormal taste. First condition that you see here, known as leukoplakia. This is not a cancer yet. It's a precancerous lesion that you would start to develop in your oral cavity. What you're going to see is this kind of a white patch, sometimes right on the side of the tongue or lower lip or floor of the mouth. Now, this looks very similar with the oral candidiasis, but the only difference is when you try to scrape it, it just cannot be removed. So that will be the big difference between this one and the oral candidiasis. So if you happen to see something white in your mouth, you can't scrape it, probably a good idea for you to make a referral, because if you don't treat right away, you can actually start to develop a cancer cells. So the actual cancer formation is known as the squamous cell carcinoma. This is the most common type of oral cancer. What it's going to start as is a non-healing, painless red ulceration affecting the mouth. It starts out very small. It's not painful at all. But the problem is within oral cavity, your cells are very actively dividing all the time. So once you start to have this kind of cancer formation, that typically is going to grow very rapidly compared to maybe some other areas in the body. So the early detection, early removal is going to be the key. As long as you get it removed right away, the prognosis is very good. Next one we have here is a Kaposi sarcoma. This is defined as the pigmented lesion that may be flat or raised. So what you're going to see, because it's pigmented, is a color. You would often see some kind of really red color or purple color, sometimes even blue or blackish. More commonly found in male. This is also another common manifestation of HIV infection, so that individual might also need to get tested as well. Start out as asymptomatic, and then it's going to grow again very quickly. So what this patient is going to be needing is a biopsy. Once they confirm that this is a cancerous formation, they can either have a surgery to get it removed, or maybe they're going to be placed on under the radiation therapy to kill that cancer. Again, as long as you find it right away and get it removed, the prognosis is typically good. Now, some teeth. You have a couple different types of teeth. You have incisors, canine, premolar, and molar. When you were younger, when you were children, maybe you had only 10 set of teeth in the lower and then another 10 in the upper, so 20 in total. As you start to grow older though, the permanent teeth is going to actually grow from the bottom and replace the baby teeth. And then whenever you're experiencing that, by the way, it's not looking too pretty. Let me show you the picture. So this is when you actually start to develop some permanent teeth. I'm glad that I didn't really see it like this, but whew, this is what happened to everybody, every single one of us. So once you're fully adult, what you're gonna have is 32 permanent teeth, fully grown, within your mouth. And here's a little anatomy of the teeth. The most superficial layer is known as enamel. And this particular layer, you don't have that much of an innervation, so when you are to injure this layer or start to develop some oral cavity, typically painless. A little deeper layer, known as dentin. This is an area where you actually get injured or get maybe the dental cavity start to grow a little bit deeper, start to affect the dentin layer. That's when you start to feel some maybe sensitivity or pain. And the innermost part right there is known as pulp. And this is where you can find, right here, this is where you can find the nerve and then blood vessels. And this teeth is embedded within your gum through all these ligaments known as periodontal ligaments. Some dental disease. Now, any really condition that can affect your teeth is considered as dental disease, a really kind of broad name. But your textbook is talking about some specific conditions here. The good one to talk about is the gingivitis. So this is the information of the gum. It's typically caused by improper oral hygiene. So what you're going to see earlier on is the plaque deposit, maybe kind of a white or yellowish looking deposit around the teeth and the gum, and the bacteria start to grow in this area, start to cause some inflammation. So the color is going to be looking pretty red and swollen, just like any other inflammation would look like. If you are to brush the teeth or the gum area, it's going to bleed very easily and it's going to be very painful as well. Bad breath and then bad taste in the mouth is another common sign of symptoms. If you don't treat this gingivitis right away and then it start to grow, start to get worse, your gum literally start to retract. So what you end up developing is a condition known as periodontitis. So as you can see, the gum part got really skinny and you can almost see the bone right underneath. It's a pretty bad picture right here. The gum started to really retract and then now the almost entire teeth, the root part, is being exposed. If this happens to the patient, they're gonna develop some tooth sensitivity and even obviously, as you can see, loosening of the teeth, and then maybe one day this might actually completely come off. This patient will need an immediate referral to a dentist and maybe also dentist. Typically they'll get an x-ray in the office to determine the extent of the damage. And the dental caries or dental decay. Mechanism is very similar, so you're not practicing a good oral hygiene and then the plaques start to deposit and the bacteria start to grow. Earlier on it might just looking pretty white and chalky, but later it will turn black and brown and then really start to eat your teeth. You can visibly see it's going to be very painful. Early on, typically it's asymptomatic if it's just affecting the enamel layer. Once you start to affect the little bit deeper layer, that's when you start to develop sensitivity to cold or hot, toothache, and it's not uncommon for people to develop gingivitis with it because the mechanism is the same. And if you don't treat right away, you can sometimes develop an abscess, maybe more towards the root of the teeth, and sometimes the abscess might start to grow, and then this is going to be very painful. So what this patient might need the most, definitely referral to the dentist office, but what they're gonna need is the education on how to brush teeth. It might sound a little bit stupid, but there's a correct way to brush your teeth, and then there's an incorrect way to do it. So people at dentist office will often use some kind of a staying method, so you can really highlight the plaque deposit as well as the bacteria deposit, so they can actually teach you how to hold the toothbrush, and then how you're going to stroke, what kind of a brush would be good to use, or what kind of even toothbrush would be the best to use. So that kind of education is very, really valuable really for all of us. There are a couple different kinds of dental caries depending on kind of where it starts to grow. It has a little bit different name to it. Pit and fissure cavity, as you can see here, that's the one that you start to see over the almost like a valley of the teeth. So these are a good example of the pit and fissure cavity. If you develop a cavity right over this nice smooth rounded area surface, it's known as smooth surface cavity. Not a too pretty one to look at. A little bit up here. This one is in between the teeth. If you develop some cavity over the root area a little bit deeper, which it may not be too visible earlier on, but if you start to get really bad, you can actually see it, known as segmental or root cavity. If the damage starts to really grow, if it's just affecting superficial layer, you can typically just shave it off, and then you're gonna be fine as long as you get the good education, know how to brush. If it starts to affect the deeper layer, sometimes the root canal might be necessary, or sometimes you might have to remove the entire tooth. So that is it for the oral conditions. Eye condition presentation is going to be coming up very soon. So before you go to bed, one suggestion that I can give you for the day is make sure you brush your teeth. Good night. Bye bye.